no cleaning with alcohol. Just looks kind of gnarly, to be honest with you. Yeah, it's kind of spread over his foot. Double footer. A lot of vloggers don't show this side of travel. Today we're on a little bit of a medical mission. My mate Taylor, he's got, it looks like maybe a bit of an infection on his foot or something like that. So we're going to go to the local clinic and go get it checked out. I'll just show you what it looks like now. Looks kind of gnarly, to be honest with you. Yeah, it's kind of spread over his foot. So double footer. In Asia, this is quite common. A lot of vloggers don't show this side of travel. You'll often pick up either parasites or fungal infections, skin infections and things like this. And I've not seen any videos on how to deal with that when you're actually out traveling. So the current situation is, how long have you had this, Taylor?
I've had it for about 2 weeks now. It's progressively been getting worse and worse.
So Taylor's had this for 2 weeks now, so yeah, it's not getting any better. We're gonna go check it out with the clinic. A little bit apprehensive because we're in Laos, so have to be careful how I put this, but medical knowledge is a little bit limited sometimes in the clinics, but we're going to try and get a blood test or something for him just to check out what it is. We've arrived at the clinic now. Looks really nice and clean, looks really professional. Taylor's just had his blood pressure checked and he's just given in his information, and now we're just waiting to be seen. There was no language spoken. We just walked in, they handed us a form. Taylor filled in his details. Just speaking to the doctor, and Taylor's going to have a blood test because he thinks it's an infection. So he's also going to get tested for things like syphilis and HIV just whilst he's here. It's just good practice whilst you're travelling to look after yourself. And in fact, even though I have no symptoms or anything like that, I'm going to also have a blood test and a blood screening. It's really important that when you're travelling that you look after yourself, you look after your body. Any pain? No pain. I've just had my blood test now. It's quick, painless, very clean. They're very professional here. They've said that it will take 5 minutes for the lab results to come back, which I think is really quick and convenient. So just waiting on that now. How did you find it?
I found that really useful, to be honest. You know, now I've got a bit more direction as to how I can go about sorting out this infection. I found out it's not actually an infection, so I've been suffering from dermatitis for the last 5 years. And since I came to Asia, it's actually made it a lot more difficult for me to deal with. I think
like the humidity.
Yeah, it's definitely got something to do with the humidity, and you know, Asia itself is actually a really dusty place, and you know, the flies are always around.
You said what? It's not like a serious infection or anything.
Nah. So I didn't even get any antibiotics or anything like that. I've got some antihistamines, some steroid cream, and they gave me some vitamin C pills.
Yeah.
They told me just to use saline to clean it. Instead of using alcohol, and to not even put betadine on it, and just to kind of allow it to heal over time itself.
Yeah, so just no cleaning with alcohol, just salty water, which is something I wouldn't have known.
Me neither, to be honest.
I've been having some stomach problems because I had appendicitis a few months ago, so I had to have a blood test. The initial results show up clear, but because I'm getting so much pain at night time, I've been recommended to go to the NTA in the capital to go basically get a cancer test, just to go get that checked out, and also have a colonoscopy where they put a camera up your bum to go and check out your bowels. But anyway, that's that done. We now know Taylor doesn't have HIV or syphilis. What's the name of this clinic?
Pakistan. It's right next to the hospital in Luang Prabang.
This is the clinic here. Yeah, so come here. They speak some English as well, which is good. Anyway, that was a quick medical trip. Hopefully you learned a little bit. It was kind of interesting to you. Peace. If you like any of my content, just subscribe, share it, like it. Have a nice day.